Florida's recording more COVID-19 cases than any other U.S. state as hospitalizations in some areas increase at the fastest rate since the start of the pandemic. Florida accounts for 1 in 5 new infections in the U.S. and logged more than 73,000 cases over the past week, according to the CDC. Florida had 341 cases per 100,000 people over the past week, second only to Louisiana. Deaths in Florida totaled 319 over the past week, the most among states with a rate of 1.5 per 100,000 people, fourth highest according to the CDC. Joining me on the morning show, Dr. Jonathan Kantor, an epidemiologist with the Penn Center for Epidemiology. Dr. Kantor, Dr. Anthony Fauci says we are in an unnecessary predicament and going in the wrong direction, and he is frustrated. Do you agree? We did not have to be here?
Clearly, if we were in a country where we did not have vaccines available, or if we were at a time point where there were no vaccines available, I think it would be very understandable to be in the position that we're in. I think the frustration that we're hearing from Dr. Fauci is this concept, this idea that we've got vaccines freely available, we've got enough vaccines for the entire population, and that people are not availing themselves of it. And I think that's really becoming a source of frustration a little bit for the public health experts who are involved in this communication strategy. And I think that is the challenge, and that is the strain that we're hearing coming from Dr. Fauci.
Florida's Governor Ron DeSantis says this is a seasonal thing. He's getting a lot of pushback from doctors. Florida's leading the nation in COVID deaths. We just talked about that. Is his messaging dangerous?
Well, I don't know that I'd say the messaging is dangerous. I'd say that the messaging overall in terms of response to the pandemic has been very challenging coming from all corners. I think there's been a lot of concern about the messaging initially from CDC saying we don't need to wear masks if we've been vaccinated. That is in part what Dr. Fauci is kind of, signaling the potential for an about face on. So I think there's a lot of back and forth signaling. When you're in a pandemic, when you're actually on the ground in this, of course, as you are, as I am, and as all the viewers are, I think it's very, very different from when we read about things in the history books. In the history books, it's very easy to look back and say they should have done this, they should have done that. They're able to see the full arc of the situation. They're able to really gauge what was going on. I think for us living through this, I think we're seeing all those little challenges, all the little hiccups that come up. And I think that is a challenge for everybody in government. And I think everybody is really trying to do the best they can, but it's not an easy situation, and it's not one where necessarily everybody has really been doing things the way in retrospect we think would have been ideal from the first place.
I understand the woulda, shoulda, coulda, but let's talk about that messaging on masking. We know the American Academy of Pediatrics says, hey, if we want to protect our kids in school with what's going on, they should wear masks. Again, to Dr. Fauci, he says the CDC is seriously thinking about saying we should be wearing masks. DeSantis says no matter what, no mandates. He calls it muzzling. All right, so if the mandate comes down, what does Florida do?
Hey, it's a challenge, right? Because you've got, even without considering the Florida situation, you have the U.S. guidance, the guidance from the CDC, which was saying basically if you've been vaccinated in the school system, you don't need to be wearing a mask. And then early last week, you had the American Academy of Pediatrics, which represents essentially every pediatrician in the U.S., coming out and saying everybody in the school should be wearing a mask. So regardless of vaccination status. And so we've got this tension now between the different kind of camps coming out. And I think what's happening is you're seeing the American Academy of Pediatrics kind of trying to push the idea of, really more aggressive masking. I think the CDC was trying to thread the needle a little bit, trying to encourage those who have not been vaccinated to get vaccinated so that they would get the benefit of not having to wear a mask. And I think what we're seeing now is all of this challenge playing out at the level of Washington.
Now, we've got to take politics out of everything is probably the bottom line. Let me move on to something else. For those who are vaccinated, let me ask you about breakthrough infections. If you're in a community with a lot of infections, are you more likely to develop a problem? Now, I heard an analogy before that the vaccine is like a raincoat. If there's a drizzle, you're fine. But if you go from thunderstorm to thunderstorm, you're likely going to get wet.
Yeah, I mean, you can think about vaccines and masking as a raincoat analogy. Even something closer to home for the viewers that has really been, I think, drilled into us over the past 3 decades is, the safe sex analogy, right? This idea that if you're going to have sex, use protection. But there's no idea there that using protection is going to, keep you from, contracting any sort of infection or becoming pregnant or anything else. It's just going to help you in that situation. And of course, the more risky behavior you engage in, the higher your risk is going to be of running into problems. And I think that's what we're seeing here in terms of vaccines. If you are somewhere where there's not a lot of virus around you, then you're probably going to be fine with just, having the vaccine, not wearing a mask. Certainly if you're going for walks outside, et cetera, I don't think there's any need to be masking. But at the same time, if you're going to be in a hotbed of virus, particularly with the Delta variant, then I think it's the same situation as with the safe sex analogy. It doesn't mean that you can do whatever the heck you want just because you're wearing a condom. And I think that is really kind of the key message. It's the same thing we've been telling our teenagers for years. And I think that's the same message that we need to kind of be thinking about for ourselves as well.
And maybe is it time to start adding a booster?
There's been a lot of discussion about that. Again, there's a little bit of drama again on that federal level with kind of Pfizer coming out and signaling that they were going to be applying for boosters, and then the CDC coming out very quickly and FDA jointly saying, oh, whoa, we have not said that we're going to need a booster yet, and we're the ones who decide. So I think there is we've seen kind of from the tea leaves that looking down the road, definitely, Dr. Fauci already mentioned yesterday, for certain populations, I think it's going to be very quickly suggested. And I think down the road, particularly if the Delta variant or if other variants of concern or of interest kind of crop up that really become, a source of challenge for those who are already vaccinated, I think there's going to be more of a trend towards boosters. But again, it's hard to say right now what direction things are going to go.
Dr. Jonathan Kantor, always a pleasure. We'll probably talk again inside the next week. Have a great day.